Hello, I'm Yasser Janab and Najm Sadat Musavi presenting the case percutaneous varicocele embolization in nutcracker syndrome. In the case of testicular varicocele, the pampiniform plexus, which is associated with gonadal vein, is dilated. In addition to being associated with pain and discomfort, it can also affect fertility in adolescents and adults. Varicocele embolization is a minimally invasive procedure that allows faster return to normal activities as well as significantly lower cost. To ensure that both large and small veins are occluded, most commonly a combination of thrombogenic fibered metal coils is used in conjunction with the liquid sclerosant. You should also know the nutcracker syndrome. A nutcracker syndrome occurs when the left renal vein is compressed symptomatically by the superior mesenteric artery. Nutcracker syndrome is characterized by left gonadal vein insufficiency and manifests as varicocele in males and pelvic congestion syndrome in females. When patients have symptoms of nutcracker syndrome, treatment is indicated. There are several surgical and endovascular options between observation and nephrectomy as management options. In young patients, conservative management and surveillance is recommended due to the greater likelihood that spontaneous remission will occur. Our case is a 16-year-old adolescent with a history of grade 3 left varicocele from 2 years ago. He had no other diseases and his urinalysis was normal. Diagnosed as nutcracker syndrome by abdominal ultrasound and MRI, he was referred for an endovascular treatment by a neurologist according to abnormal seminal analysis. Due to nutcracker syndrome, surgery is likely to result in a recurrence of varicocele. Therefore, endovascular treatment was selected as the preferred method because recurrence is probably unusual with this procedure. Our access was right femoral vein. We also used Cobra catheter 5 range. The gradient between inferior vena cava and left renal vein was about 5 mm of mercury, which is diagnostic for nutcracker syndrome. The injection in gonadal vein shows reflux of gonadal vein during Valsalva maneuver with filling of pampiniform plexus. Common support catheter compatible with O35 wire was applied to place 10 and 5 mm pushable coils in distal portion of left gonadal vein as you can watch in the video. After distal coiling, foam sclerotherapy with 3% fibroin was used to apply sandwich method in this patient. Amplatzer duct occluder was applied for complete occlusion of proximal portion of left gonadal vein. You can see the final video with injection in left renal vein and distal coils in left spermatic veins, foam sclerotherapy between, and duct occluder in proximal portion of left spermatic vein. In summary, gonadal vein embolization offers an effective, minimally invasive treatment for symptomatic varicocele and represents a viable first-line alternative to the traditional surgical approach, especially in patients with nutcracker syndrome. Thanks for your watching.